Dehydration occurs when the body loses more fluids than it takes in, leading to an imbalance that can impair normal bodily functions. Water is essential for regulating temperature, maintaining cell structure, aiding digestion, and facilitating waste removal. Without enough water, the body's systems can't function properly, and severe dehydration can lead to serious health complications. Causes of dehydration. Dehydration can happen due to various reasons, such as inadequate fluid intake, not drinking enough water, especially in hot weather or during physical activity, forgetting to hydrate regularly throughout the day, excessive fluid loss, sweating, prolonged exercise, hot and humid weather, or fever can lead to significant fluid loss through sweat, vomiting and diarrhea. Gastrointestinal illnesses can cause rapid fluid loss and make it difficult to replace fluids fast enough. Fever, higher body temperatures increase the need for hydration. Urination, conditions like diabetes, medications e.g., diuretics or excessive alcohol intake can cause increased urination, leading to fluid loss. Illness or medical conditions. Chronic conditions such as diabetes can lead to dehydration if blood sugar is not well controlled. Infections, fever, vomiting, or diarrhea due to infections can quickly lead to dehydration. Burns. Severe burns can cause the skin to lose large amounts of fluid. Symptoms of dehydration. Dehydration can range from mild to severe. Early recognition of the symptoms is essential to prevent worsening dehydration. Mild to moderate dehydration, dry mouth and throat. Thirst. Feeling thirsty is one of the first signs of dehydration. Decreased urine output. Urine may appear darker in color and be less frequent. Fatigue or lethargy. Dizziness or lightheadedness. Dry skin. Headache. Muscle cramps. Severe dehydration. Severe dehydration is a medical emergency and can lead to life-threatening complications. Symptoms include extreme thirst, very dry skin and mucous membranes like in the mouth, nose, and eyes, rapid heart rate or palpitations, rapid breathing, sunken eyes, low blood pressure, confusion, irritability, or delirium, little or no urination, severe dizziness or fainting, cold, clammy skin. In infants and young children, dehydration can manifest as dry diapers for more than 3 hours, no tears when crying, sunken soft spot on the head fontanelle, lethargy or irritability. Diagnosis of dehydration. Diagnosis is often based on physical signs and symptoms. In more severe cases, medical tests may be needed to assess dehydration levels. Physical examination. The healthcare provider will check for signs of dehydration like dry skin, reduced skin elasticity, trigger low blood pressure, rapid heart rate, and abnormal breathing patterns. Blood tests. These tests measure electrolyte levels e.g., sodium, potassium to detect imbalances that may result from dehydration. Elevated blood sodium hypernatremia often indicates dehydration. Urine tests. A urinalysis can show how concentrated the urine is. Dark, concentrated urine is a common sign of dehydration. Ketones or elevated specific gravity in the urine can also indicate a lack of fluids. Treatment of dehydration. The treatment for dehydration depends on its severity. Mild to moderate dehydration. Oral rehydration. Drinking water. Oral rehydration solutions or electrolyte-containing fluids like sports drinks can replenish lost fluids and salts. Homemade oral rehydration solution, a mix of water, sugar, and salt can also help restore fluid and electrolyte balance. Dietary adjustments. Eating foods with high water content, such as fruits and vegetables e.g., watermelon, cucumber, oranges can contribute to hydration. Avoid caffeinated or alcoholic beverages. These drinks can increase urination and fluid loss, exacerbating dehydration. Severe dehydration. Intravenous IV fluids. In cases of severe dehydration, especially if a person is unable to drink fluids or has lost a significant amount of water. IV fluids are administered to restore fluid levels rapidly. Hospitalization. People with severe dehydration, especially those experiencing confusion, rapid heart rate, or shock, may require hospital care to monitor electrolytes and vital signs. Prevention of dehydration. Preventing dehydration involves maintaining proper hydration, especially under conditions that increase the risk of fluid loss. Key strategies include: drink sufficient fluids. For most adults, the recommended fluid intake is 8 to 10 cups 2 to 2.5 liters of water per day, though this can vary based on factors like activity level, climate, and overall health. Increase fluid intake in hot weather or during exercise. If you're active, sweating a lot, or in a hot environment, increase your fluid intake to make up for lost fluids. Monitor fluid loss. Be mindful of urine color. Pale yellow urine indicates good hydration, while dark yellow or amber urine may be a sign of dehydration. Balance electrolytes. For people engaged in prolonged physical activity or experiencing vomiting or diarrhea, consuming electrolyte-containing drinks such as sports drinks or ORS can help replace lost salts along with water. Avoid diuretics. Be cautious with caffeinated or alcoholic beverages, which can increase urination and fluid loss. Hydrate during illness. During periods of illness, particularly with fever, vomiting, or diarrhea, it's important to drink more fluids than usual. Risk factors for dehydration. Certain individuals are at higher risk for dehydration and should take extra precautions. Infants and young children. They are more vulnerable due to their small body size and faster metabolism. They can lose fluids quickly during illnesses or hot weather. Older adults. Aging decreases the sensation of thirst, making older adults less likely to recognize dehydration. They may also have medical conditions or take medications that increase dehydration risk. People with chronic illnesses. Conditions like diabetes, kidney disease, and adrenal disorders can affect the body's fluid balance. Athletes. Physical exertion, especially in hot or humid conditions, increases fluid and electrolyte loss through sweat. Pregnant and breastfeeding women. Fluid needs increase during pregnancy and breastfeeding to support the growing baby and milk production. Complications of dehydration. Severe dehydration can lead to serious complications if not treated promptly. Heat injuries. Heat exhaustion or heat stroke can occur during hot weather or vigorous exercise if fluid levels are not maintained. Kidney damage. Prolonged dehydration can lead to kidney stones, urinary tract infections, or even kidney failure due to reduced kidney function. Seizures. Electrolyte imbalances caused by dehydration can lead to abnormal electrical activity in the brain, causing seizures. Hypovolemic shock. Severe dehydration can cause a significant drop in blood pressure, leading to shock. This is a life-threatening condition that requires immediate medical intervention. Conclusion: dehydration is a preventable condition that can range from mild discomfort to life-threatening complications. By maintaining adequate hydration, especially during hot weather, exercise, illness, or certain medical conditions, you can avoid dehydration and its associated risks. If symptoms of severe dehydration occur, such as confusion, rapid heartbeat, or fainting, immediate medical attention is essential.